Hello, I'm Amber, and I'm going to be talking a little bit about play therapy. Just giving an overview of what play therapy is, how it's effective, and give you a basic understanding of what kiddos do when they're in play therapy. When we're thinking about children who are the clients in play therapy, we really want to know who they are. And through play therapy, one of the things that we seek to do is really seeing the world through a child's eyes. Children, like we'll talk about again later, are not miniature adults. And so um, they have a different way of seeing and experiencing the world than adults do or teenagers do. And so, um, really, if you can think to your own life and you can think of times when you have felt out of the loop or misunderstood or have struggled to have something happen, um, one of the things that really I'm sure has been helpful to you is really to have someone understand how you see things, how you experience the world, what everything means for you. And this is really one of the things that we're seeking to learn about the children that we work with through play therapy. Who are you? How does the world look for you? One of the other things that we think about when we think of children and play therapy is the difference between teaching and experiencing. And so, in your life, if you can think of a time when you've been taught something, say in a classroom or in a conference or um, just out at a lecture or out at a dinner, in fact, and just through discussion, someone wants to teach you something. The difference of engagement and the difference of the level that it changed, the difference in the level of change that you experience is probably different than if you experience something for yourself. So if I tell you how to run a mile, that's very different than you experiencing what it feels like to actually run a mile. And you're really not going to have a sense of the pacing or the stamina or the impact on your body if you are taught how to run a mile versus if you experience how to run a mile. The same thing goes for children, though. Experience is really the factor that changes behavior. Um, Me telling you how to run that mile isn't going to change how you choose to approach running that mile. But you having had experience running a mile and knowing how to pace your breathing and how to adjust which way you're leaning at different points, those things can really impact how you behave later. And that's really one of the central ideas of play therapy is that we are allowing a child to experience things rather than teaching them things. Again, going up to seeing the world through the child's eyes, this really connects to listening to the child. We really want to understand children because we believe that you must understand a child to begin with for anything else to make a difference. And so, listening with your heart, not just your ears. This really goes back to seeing the world through a child's eyes, understanding how that child feels. So often in our lives, I think we get distance, we get separated from how we feel, and we're not able to acknowledge that. And in child-centered play therapy, what we're doing is we're really listening with our hearts to understand how the child feels and really empathizing with the child so that the child gets the experience of feeling like an important and worthy person. And then finally, when we think of children, play is an essential part of child development. We have a very developmental perspective. We know that as children develop, their play behaviors change, their needs change. But play is when you're thinking not only in terms of general child development, but in terms of neurological development, play is a very important part of making sense of experiences. So, like we talked about on the previous slide, children aren't miniature adults. Their brains develop differently than adults, or their brains are developing, and so their brains are necessarily different than adults' brains. And so, one of the things that it's important to draw attention to, again, like we talked about in the previous slide, the difference between teaching and experience is also the difference between description and experience. So if I describe what it's like to, say, ride a bike to you, um, this is going to be very different than you experiencing riding a bike. And if you can really, if you can describe something, it's almost as if um, you haven't had the experience, because experience is so different phenomenologically from description. And so, what we really want to recognize in this is the limits of words, and how words cannot always convey the meaning and true nature, the essence of an experience. Um, just looking at the communication model, 7% of the meaning that we gain from spoken words is the meaning of the words. 38% is paralinguistics, so that's my tone of voice, that's my pronunciation, that's the way the words hit the hearer's ears. And so 55% of meaning is in facial expression, though. So the vast majority, almost over 90% of 93% of communication is not actually the words that are spoken. It's very much either in, like we said, tone of voice, or it's in the nonverbals. And this really goes to show, again, how much of our experience is really not about the words. And child-centered play therapy, what it really seeks to do is give the importance of the experience to the child. So one of the things that we consider in child-centered play therapy is our philosophy about children. And so, like we talked about a little earlier, children are not miniature adults, and they don't need to be treated as such. Their experiences are different, their sizes are different, their capabilities are different, and so we do not need to treat children as miniature adults, which means that we're not going to have the same expectations for children. And we're not going to expect them to heal and process information in the same way. Children are concrete. Developmentally, this is very accurate. Children need objects, and they need physical things in their presence to really make sense of them. They're not capable yet of the hypothetical deductive reasoning. They're not capable of always using language to express themselves. This brings us to the next bullet point, that play is the natural language of children. Through play, children make sense of their worlds, and excuse me, they are able to express what they understand about the world in that concrete way. We really believe that children are capable of positive self-direction. They possess an inner intuitive wisdom, and a they have an innate desire to grow and become more. And so part of what our task is as therapists is to really trust that and really bring that, help them express that. Children are unique and worthy of respect. One of the things that we really believe is that children need to be prized for the uniqueness and specialness of each unique person. They have an inherent tendency towards growth and maturity, Um, their bodies want to continue developing, their minds, their emotions want to continue developing towards growth and maturity, and the therapist really needs to trust them about that. Child will take the therapeutic experience where it needs to be. Again, we need to trust the child to know what the child needs, because often, if you've ever been pushed to do something that you aren't ready to do or don't really want to do, it's not a very successful experience. You don't tend to walk away from those experiences gaining very much. And so, in trusting the child that the child will take the therapeutic experience where it needs to go, we are honoring the child's needs and capabilities. Children's growth cannot be accelerated or speeded up. Each person, each child grows in their own time, and no amount of pushing them is going to make things happen faster than the child needs to. Again, we trust the child to know inherently, intuitively what the child needs. And so the child's growth needs to happen on its own time. Each child, as we know from child development, develops at a slightly different pace in different ways, and that's okay. We really don't want to ask the child to be any different than who they are. And finally, children have a right to remain silent. Sometimes they're not ready to talk about things, or they don't want to talk to the therapist, and the therapist really needs to honor um, the child's need to be quiet and not say anything. So for play therapy, one of the things that it's helpful to consider is, what is play? Oftentimes people can get play very confused with entertainment or amusement, but play is really a distinct activity. In child-centered play therapy, we believe that play is children's natural language. It is the way that children make sense of the world, and it is the way that they express themselves. Um, Play, as opposed to amusement, diversion, entertainment, is spontaneous. It's universal and it's voluntarily chosen. So everyone plays, even adults play. We joke with people who we're close to. Um, we laugh. We do things that are just because we enjoy them. Personally, I do the adult coloring books, and that's something that I do not because I have an agenda. I just choose to do it because I enjoy it. And so the spontaneity of it is, when I feel safe and when I feel ready to do it, I do it. That is play. Play is a process, it's pleasurable, and it's person rather than object determined. Play is not to produce anything. The inherent pleasure in play is simply um, because it's enjoyable, because it's pleasurable, which that's why it's process rather than product oriented. It's about doing the play rather than producing something, and it's person rather than object determined. The person doing the play, the person enacting the play, that's what's the center of the play. It's not about the thing that I produce. It's not about any sort of. I always think of Hot Wheels or Matchbox cars and those like tracks. That's when parents or when caregivers want children to play with those tracks and the cars in exactly the way that it's been lined up on the box or on the TV. Um, that's when it's object determined, and that's when it becomes not fun for the child. But when the children get to have all of those pieces spread out all over the floor and can just make the cars fly up and down in the sky and don't need to worry about how the thing is supposed to be constructed, that's when the play is person determined. So again, on the other side, it has no rules, it has no product, it's not goal oriented, it's process oriented, um, it's spontaneous and free, and it is not goal directed. It's just for the pleasure of having it. Um, it's variable across situations and children. Play looks different in different cultures. What you're going to play with and how you're going to play is going to be impacted by the culture you live in, as well as individual children within a culture. Um, I know I have a younger brother, and I played roller skates and I played Tea Party, and my brother didn't play either of those things. He really liked to play basketball and play baseball with his friends. Um, and even with that, play doesn't necessarily tell us about the children's behavior. Play is a way to freely express and explore oneself, and so doesn't necessarily tell us everything we need to or everything we're wondering about how children behave. But one of the most important things to think about when we're thinking about play is that it occurs in safety. If you think to the very beginning of this slide, when we talked about how even adults play and adults can joke around with each other, for example. Oftentimes, when you feel threatened or you feel safe, or, I'm sorry, when you feel threatened or you feel unsafe, or if it's a very somber occasion, you're not going to joke. You're not going to get a laugh. And that's because really it's not emotionally safe to go to that place, to take that risk. Um, Play happens when safety is present. And that's very important when we're thinking of therapy. And finally, it's self-directed creative self-expression. And that is, again, what we've been talking about for the entire slide. So then using our understanding of children and of play, we can begin to define play therapy. Landreth, in his book Play Therapy, The Art of the Relationship, defined play therapy as a dynamic interpersonal relationship between a child and a therapist trained in play therapy procedures who provides selected play materials and facilitates the development of a safe relationship for the child to fully express and explore self, feelings, thoughts, experiences, and behaviors through play, the child's natural medium of communication for optimal growth and development. And so, a couple of the key points in the definition of play therapy are that it's a dynamic interpersonal relationship. Um, this is it's an authentic and meaningful and safe relationship between a child and a therapist. And oftentimes, when we think of children's relationships, we don't think of such such a unique and open and meaningful relationship that a child is capable of having, or that children typically have. But really, children are very capable of having very meaningful relationships. And so, the first tenet of play therapy is that it's actually a relationship. Um, and the dynamic part is that it changes as the child changes throughout the course of therapy. The relationship necessarily changes too. We'll go into a little bit more of some of the other facets of the definition, including the selected play materials. They're very purposeful play materials, which facilitate development of a safe relationship. So there's very purposefully selected materials which help which help the process of relationship building between the child and the therapist, so that the child can begin to feel safe. And when the child feels safe, the child can really express and explore themselves, all the facets of themselves through play. so that they can begin to experience that innate drive towards growth, maturity, and development. So, in thinking of children going through play therapy, some of the things that we assume about children are that they're experts in their own lives. Um, you, as an adult, know your life better than anyone, and would probably be quite offended if someone told you that they knew something about your life more than you know. Um, Similarly, children are the experts of their own lives. They know how they see the world, they know what their experiences are or what they perceive them to be. And what we need to do as therapists is really trust them. Um, Children are capable of experiencing great pain, especially in safe relationships. Um, as an adult, you probably have had experiences where you felt hurt or you felt pain. And um, one of the things that you might or might not be aware of is that when you are experiencing great pain, if you go into, say, the grocery store, or if you go into work, you might disconnect from that pain because it's not safe and it's not a like socially acceptable place to be so connected with your emotions. And so we recognize that to be a truth about children too. And so we want to honor that they are capable of experiencing great joy and great pain, especially when they're in safe relationships with people who understand and care about how they're feeling. Um, we cannot change the past, but we can soften the blow. We cannot stop things that have happened to children or things that children have experienced. We can't make those things be undone. We can't stop those things from having happened. But we can't. But what we can do is we can understand um, what has happened from their eyes, and we um, can provide support and understanding in a way that helps soften the impact of that experience in the immediate and in the long term. And finally, whatever children become, they were born capable of. We really believe that children have an innate tendency towards growth and maturity and um, towards becoming more than they have been. And so we want to trust them, and what the counselor's role is really to help release the child's natural capacities and capabilities. And counselors do that through creating the conditions, through the relationship that helps release what is inside the child. um, the child, through the relationship, can really learn about the child's self and learn what the child is capable of, and um, what the child experiences to be becoming more. So, if we think of the relationship as the place where the child experiences safety and the child experiences then the ability to express and explore themselves fully, then what we as counselors do is we really help create the relationship. And we do that first by showing respect. And we do that by being patient and trusting that children will emerge in their own time. Um, Dr. Landreth is known for saying that some kids are like molasses and some are like popcorn. Some take a very long time to develop and emerge and show themselves and are like molasses. And some of them just seem to pop to life like popcorn. And each process is different. But what we as therapists want to do is be patient and trust that children will express the things that they are becoming as they are ready to and as they need to. Another way that we show respect to children is by not solving problems for them. So often, children want to participate. They want to be active co-constructors of their worlds. So often children want to help and want to do things for adults. And children, adults are usually pretty task oriented and just want the task done right now and don't want to have to worry about it. But what we do in therapy is we show respect through not solving those problems for children. Um, and what this does is it shows children that we trust them. We trust them to be capable of solving their own problems. And that not only does that show them that we respect them, but it also shows them that we trust them and that we believe in them and that they're capable. We also create the relationship through providing unconditional acceptance of the child. Um, for for counselors and for parents, um, disappointment often comes from adult expectations. Somehow we want the child to be different than the child is, and that leaves us as adults feeling disappointed. But if we can unconditionally accept the child as the child is, then we don't have to be disappointed because we believe that they're good just the way they are. With this, too, we see a lot of times when children are referred to play therapy due to aggressive behavior or rule breaking behavior, if we conceptualize or if we can see aggression or those things as a will to live, there's a fight in the child to survive, then we can appreciate the courage and the strength that it takes for the child to be where they are. And some children need support to strengthen them. Some children need nurturing and quite a bit of empathy to strengthen them in times of distress. And so we can provide that support, and um, we don't need to tell them that they need to toughen up. We don't need to tell them that things are going to get harder. What we need to do is we need to support them and really accept them as they are in that moment. So if we're establishing the relationship, one of the things to think of is and remember is that play can be seen as a way of communication. Like we talked about earlier, play is spontaneous, it's natural, it's self-expression. And so if we honor all of those aspects of play, one of the things that we can kind of come to understand is that play is a form of communication. Play almost always occurs between two or more people, and so with that, we're necessarily communicating. And because of that, and because of the developmental appropriateness of play, we can understand that children communicate through play. Play is the child's natural language. They're not using words all of the time, they're concrete, and so play is the natural language. They are concrete again, and so toys are the child's words. That's why we select the toys. Through the selected toys, we want to provide children the full spectrum of words that they might need to use to express themselves. And so, because play is communication, and play is the child's language and toys are the child's words, there is meaning in play, and we can connect to children through their meaning in play. So again, if we think of play as communication, we can start to understand some of the things that the child shares or expresses through play. So often through play, the child shares their experiences. Like we talked about, play is how children make sense of the world. Often as adults, if if your boss started yelling at you about something that you didn't know that you needed to finish at work, oftentimes what you'll do is you'll go to friends and probably talk about it and vent and make sense of it. We as adults do that quite frequently, and we do it with words. What children share is their experiences through play. You'll often see kids reenacting something that happened at home, like mom getting stressed that we need to leave because we're going to be late. So oftentimes kids will reenact that through their play, and that's really them expressing their experiences. They can also express their feelings through play. Um, they can show you how an experience was for them, as well as their wants or needs. Sometimes you want something very badly and you can't achieve it or you can't get it, um, but through playing, children can understand or can fantasize about things that they want or need and that they might not be getting. And finally, through play, the child shares their self-esteem. They share how they feel about themselves, whether they see themselves as competent and capable, and um, whether they trust themselves, and also whether they struggle with that. And so, using play, using the medium of play as their language, the child shares many aspects of their overall experience. Again, because play is about the experience rather than teaching or being told or having appropriate behaviors described to them, they really get to experience um, things in play therapy. And through experience, they're really able to learn. And so, one of the things why are you coming to play therapy? There's obviously something that we want to help facilitate. And so, these are some of the things that children learn in play therapy. They learn to have self control. We trust them to get what they need out of play therapy. And one of those things that they get to practice in play therapy, they really get to experience, is having self control. They get to learn how to make choices for themselves and how choices have consequences. And these help them develop a sense of self control. Also, they learn to respect themselves. Um, they show us their level of self esteem, and because we unconditionally prize and value them, they can learn how it and experience how it feels to be prized by someone else. And through that, they can learn also to respect themselves. They also learn to accept their feelings. As we say in play therapy, um, not all behaviors are acceptable, but all feelings are acceptable. And when you have someone else who accepts your feelings non judgmentally, unconditionally, children experience that it's okay to feel the way they do, and therefore that they can accept their feelings. Um, they assume responsibility for themselves. So again, we give them opportunities to practice taking responsibility for themselves and learning to have self-control. And through these experiences, they learn how to assume responsibility for the choices that they make. Children learn how to be creative and resourceful in confronting problems. So, because we trust children to have um, to grow and to mature, one of the things that we can help them experience is that sometimes they might want something to happen that can't, and so they can experience, how do I figure out how to get this thing that I want to have happen or something similar in an acceptable way. And finally, they learn to make choices. We return the responsibility to children to make the choices, and we understand that choices have consequences, and so children experience through play therapy and learn that they are capable of making choices and how to make the choices that work best for them. We touched on this a little bit earlier, but in play therapy, the toys are selected. They're not collected. They're intentionally chosen because they serve as the words. We want to give children the most appropriate and full vocabulary that we can. And so we're very intentional about the toys that we select. Um, we select toys with the intention of establishing a positive relationship. We want the toys to be able to be used only by the child or between the child and the therapist. We want to have an expression of a wide range of feelings. We want toys that express that that facilitate the expression of not only nurturing and creativity, but also aggression and frustration. Because those are all experiences that children and people generally have. Imagine if you were frustrated at work and you went to talk to your friends about it, and all they kept saying was, "Oh, don't worry about the frustration. We are not going to acknowledge the frustration. We just want you to talk about how happy you are that you got a new car." You would be pretty frustrated by that experience, I imagine. And similarly, we want to have children have the entire spectrum of feelings that they can express through the concrete toys that we've selected. We want um, toys that facilitate exploration of real life experiences. Often, children have younger siblings who might be born or join the family, or they might go to the doctor, or they might want to explore what it feels like to cook in the kitchen. And while we would never let a 4-year-old child actually turn on a hot stove, we can help them experience what it is like to have those things through selecting intentional toys like baby dolls or play kitchenware or doctor's kits that help them make sense of real life experiences. We also allow reality testing of limits. This helps them develop self control, helps them make choices. Um, and so we do provide toys that allow, in a safe way, them to experience what limits are and what it feels like to stay within the limits and what happens when you try to push the limits. Toys are selected to facilitate the development of a positive self image and development of self understanding. We want children to learn about themselves and to really come to value and prize themselves as much as the play therapist values and prizes them. And again, with reality testing of limits, we want them to, we select toys that provide children the opportunity to develop self control through making those choices. So, because the toys are selected, we have general categories. These are broad stroke categories of toys that we use in a playroom. The playrooms are set up very intentionally with the categories of toys in very intentional places. But the categories that we look at are real life toys, that simulate real life experiences. So, doll family, doll house, puppets, figures, cars, trucks, cash registers, um, doctor's kits. These really facilitate children exploring and expressing their real life experiences. Acting out aggressive release toys. This can get, parents often have, if there's a category of toy that they have questions about, typically it's going to be acting out or aggressive release toys. But again, there's a certain rationale behind that, and that's because we don't want to limit children's expression of their frustration or their aggression, which we talked about earlier as a will to live. We want children to be able to express those things and be accepted in releasing those things without limiting the children or saying that part of themselves that experiences this is unacceptable. We believe that if children are able to express and make sense of those experiences in the playroom, that would be a much more desirable place to have them make sense of those experiences than outside of the playroom. And then creative expression and emotional release. Sand and water are very important. There's no wrong way to play with them. They simply act the way that children can play with them exactly how they want to, and there's nothing wrong that they can do with them. Additionally, we have creative expression toys like crafts corner with construction paper, glue, scissors, paint, those types of things, and blocks to help children build and tear down and those types of things too. So the play therapist is the one creating the relationship. The play therapist is the one who prizes the child, and the play therapist is the person who has the relationship with the child. And so the person of the play therapist is very important. Anyone can have a room with toys for children, but who the play therapist is and the person paying attention to and having a relationship with the child is it's vital to the process. Um, and being there is really what makes it unique. I think we've probably all as adults had the experience of having friends who are our friends that we go out with and have fun with and don't really have like deep emotional connections with, but they're people who are available and around and whatever. And then there's the people who you're really close to, and it's probably only one or two, maybe three if you have a lot of close relationships. But they're the people who are really there for you. They're the people who really get it and really tune into you and really pay attention to you when you need it. That's what the person of the play therapist does. That's the play therapist being who they are and tuning into the child. And that is a unique experience for the child. So being there is the first thing that the therapist does for the child. They're intentional about being there. The play therapist knows the importance of this time for the child. This is the child's hour. And so the play therapist is intentional about making a space for the child and allowing the child to do what the child needs to do in the room. With that, each interpersonal relationship is unique. Um, you might have a group of friends, but your relationship with each of those friends in that group is unique to you and that person. The same thing goes for therapists with children. The question is not whether a therapist's personality will influence the relationship, but how. The therapist is a unique person as well, and so there's going to be unique dynamics. Again, this is a dynamic relationship, and there's going to be unique dynamics between the child and the therapist, and that's normal and natural, and just needs to just needs to be a known part of the therapeutic experience. And finally, Dr. Landreth says, I'd like for my communication not to confuse them. Basically, we want to communicate the unconditional acceptance of the child in a way that is appropriate and in a way that doesn't interfere with their play and their play process. And so simple communication, honest communication, very genuine, but just keeping it simple and keeping it focused on the moment is important so that children don't get confused. This isn't about being complicated. This is about truly and deeply understanding and accepting the child. Children who enter play therapy, and also children who don't enter play therapy, but just pretty common to the human experience, is wondering, am I safe? Is this a safe place where I'll be accepted? Will I be accepted? Are people here going to appreciate me for who I am, or am I supposed to change in some way? Again, the child probably assumes adults think that he or she needs to be changed, which is why the child is in play therapy. And so children, it's important for the therapist to come in and be aware of these questions the child might have coming into therapy. And also, can I cope? Oftentimes, children are going through a lot, and they wonder, maybe not in those words, but they wonder, am I going to be able to make it through this? Is this what's going to happen, and where am I going to be, and what is going to come for me? And so this can be a really scary time. And so being aware of that as a therapist helps to create that intentional atmosphere of safety and acceptance for the child. So the being with attitudes really form the foundation of what therapists provide the children. The children want, um, the children are wondering, am I safe? Can I cope? Will I be accepted? Am I supposed to change? And the being with attitudes actually answer those questions. But they come from within the therapist. The therapist really embodies these attitudes. They're not something that the therapist really needs to say explicitly, but actually demonstrate throughout the course of therapy. And so, with the being with attitudes, we want children to understand, I'm here. It's being present, it's being there for the person. I hear you. I'm listening with my heart. I understand. I can really see what you're meaning and what it means to you. And I care. You're an important person, and I prize you as a person. And so it's through the interactions that the therapist has with the child that the therapist will demonstrate these attitudes rather than ever saying them. But these attitudes really do come from within the therapist at a very deep level. So, in incorporating the being with attitudes into being with the child, um, one of the ways, or some of the ways that we demonstrate it, is through staying in the moment with the child, so the child can have the freedom to be who they are and change in their own way and in their own time. Again, the molasses and the popcorn. Um, Staying in the moment, being present, really being there, really seeking to understand and listen with your heart rather than just your eyes or your ears. Being genuine about being interested in the child. Discovering about the child what no one else knows and what the child may not be able to communicate with words. Um, Sometimes, if someone close to you has ever noticed something about yourself that you're either unaware of or you feel like no one really understands, how amazing it feels to feel seen in that way. And so, what we want to do as therapists is always approach the child with the new eyes of wanting to discover and learn all about the child. Giving to the child, giving what you have. Like we talked about, each person, each therapist is going to be unique. And so each person is going to have different things to offer in relationships. And what the child needs is what you have to give as a person to the child. Um, and also, just as adults, we can provide time, attention, concern, trust, and care to the child by really just being present, really seeking to understand the child and seeking to know more about how the child experiences the world. Again, with being present, oftentimes we as adults can get pretty hard on ourselves if we do something that may not be exactly desired or exactly what we were planning, and we can get caught up in that. But in staying present with the child so that we can really learn about the child, because this is what it's really about, is providing attention and care and concern and valuing and prizing to the child. We want to be present. And so one of the things that we can remember is that it's not what you did, but what you do after what you did. So remembering that it's okay if we make mistakes, it's okay if we accidentally step out of line, but really what we want to do is make sure that we come right back in and we always return to I'm here and I see you and I understand and I care. So, getting to a little bit more of the therapeutic uses of play therapy. It's appropriate, like we talked about, for children ages 3 to 10 years old. It allows for an intense interpersonal relationship. It's the relationship is the foundation and is the really the core of what the therapy is having a relationship where the child feels valued and accepted for who the child is, and the child receives the message that the child does not need to change one iota. This can be a very intense experience because many of us don't feel that way in our own lives as adults. And so, for a child to experience that the child is completely accepted as the child is can be very intense and very different from many other experiences. Um, it helps children overcome defenses and express their fantasy life. We like to say in play therapy, you grant in fantasy what you can't grant in reality. So sometimes we know that the dragons aren't going to come down, but sometimes the child needs to act that out and needs to experience what it might feel like if the dragons came to the castle. And so rather than telling them that they cannot experience that and blocking them from some sense of their experience, we facilitate we facilitate children's fantasy, imagination, and creativity. It helps children communicate by creating a distance, so they don't need to talk directly about what they're experiencing at school or what they're experiencing at home, but rather we allow them a medium of communication through play and providing them the toys that they can use, and also making it so that they don't have to directly experience any of the things that are happening in the outside world. They can have distance and they can look at things that are happening, whether or not they realize that they're doing it. It helps children deal with emotional experiences through symbolism. Again, children are concrete. They might not have the linguistic capacity and development, and certainly don't have the symbolic representation to express what their experiences are. But through symbolism, through the natural language of play, they're able to deal with their emotional experiences in their own way and in their own time. And finally, it allows the therapist and the child to see the issues that the child addresses and might struggle with. The child can express those experiences through play and provide someone else the opportunity to understand and care what those issues are. So, from all of these ways of being the therapist, ways of being in relationship, the respect and trust that we have in the child, and the being with attitudes, I'm here, I see you, I understand, and I care, um, we facilitate the relationship and we facilitate the child's growth and development and acceptance of the child through specific responses that are designed to have maximum impact. And so, tracking is one of the ways that the therapist can get into the child's world. Remember that the child is granted silence. If the child doesn't want to talk to the therapist, the child doesn't have to. But the therapist can, through their words, follow the child around in the room and communicate to the child that the therapist sees and understands what the child's doing. And so this looks very to unseasoned play therapists, this can feel a little awkward, but basically, it's very much looks like the therapist saying, you're walking around and you're looking at all of the things in the room, and you're picking that up, and um, you're running your fingers through there. Maybe if the child's running their fingers through the sand, and really, what this does is initially it allows the child to know that the therapist is interested in what the child is doing or what the child wants or how the child's feeling. And then Also, it allows the therapist to really have an understanding of what the child's world is beginning to look like. Reflecting feelings. This is when the therapist's or the child is expressing some sort of feeling, either verbally or non-verbally, um, either through facial expression or body posture or intent focus. And the therapist can reflect to the child and say, oh, you're feeling excited, or oh, you're feeling angry, you're feeling frustrated. And really reflecting the feelings to the child allows the child to become more aware of their feelings and feel understood and accepted in how they're feeling. We return responsibility to the child. We demonstrate that we trust the child by returning the responsibility. The child gets to make the choice. Oftentimes, children are told what they need to do, and all sorts of decisions are made for children that they can really make for themselves, as well as things are done for children that they can do for themselves. And so, what we do is return responsibility to the child. The child now gets to decide for themselves, and the child gets to do for themselves. So, sometimes children are adults sometimes need to be needed. And so, for example, if there's a toy on the top shelf and the child wants it, but the child is a little short, some children won't want to reach for it. They'll ask the therapist. And a way of returning responsibility to the child is to say, and here you can reach for that. You can choose to get that, and have the child take the responsibility of finding what they want for themselves. Esteem building. Many parents are very well intentioned and often praise their children. But what we believe is that praise sends a message of I want you, or I accept you, or I value you, or prize you when you do this, not that. And we really want the child to understand that and experience that we prize them for the person who they are rather than anything that they do. And so esteem building really acknowledges all of the efforts and all of the intentions that a child has, rather than the product that the child produced. Again, play is a process-based experience rather than a product-oriented experience. And so esteem building really acknowledges the process of you put a lot of effort into do this. You tried really hard to do this. Rather than saying you made a great painting. Enlarging the meaning can really connect to the symbolic experience of the child. So if the child is experiencing or expressing some excitement at going to the airport in the playroom, and you know that the child has an experience coming up where the child's going to travel, you might say, man, you're really excited to go on this trip, which both connects to the literal play in the room and also the larger experience of going to travel that the child is going to have. And then limit setting and choice giving we'll go over in just a moment. So, like we talked about, some of the things that children learn are not only responsibility, but also self-control and how to make choices in play therapy. And so many times children learn these through limit setting and choice giving. And so what we really want to do is always, 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 always accept the child for who they are in the moment. Sometimes children have trouble deciding. Sometimes children are pushed beyond their limits. And so what we want to do in these situations is help the children learn to make choices in different ways. And so we don't want to stop that behavior. And we also want to remember that any way the child feels is acceptable. And so we want to facilitate the expression of the motivating feeling, want, or need into a more acceptable behavior, um, or acceptable manner. So really, again, we're not trying to stop the behavior. We're not worried about necessarily what the behavior is. We always want the child to be safe. That is a given. But what we want to do is we want to help the child learn how to make choices in different ways, so that whatever they're feeling, they can express in a different way. And with that, with these limits that we provide, the idea is that limit setting must be consistent. And with consistency comes predictability, security, and safety. We choose to set limits because it promotes therapist acceptance. I'm sure as a therapist or as a person who works with children or is around children, there are certain things that children might do that are just simply kind of get on your nerves, and that's okay. But by setting a limit, we can say, you know what, that behavior is not acceptable, but I really value you as a child or as a person, and I want to maintain my connection with you. It's through this limit that I can. And so one of the things I'm thinking of is often very young children don't have a very acute sense of, or a very aware sense of personal space. And so oftentimes they'll give you something and they'll give it to you straight in your face, just like 2 inches from your eyeballs. And that can be a very jarring experience for a person. And so one of the limits that might need to be set, just depending upon therapist need, is not having children give them or give you their toys right in front of your face. So saying, children, you can choose to give it to me in your hand, or you can choose to give it to me by my foot, which sounds silly, but when you're sitting down and you're on a child's level, it makes a lot more sense. And so even in that, a lot of the limit setting language, and there's a very specific limit setting model that is used within child-centered play therapy, which is kind of beyond the scope of this presentation. But really, what happens in limit setting is that limits are set and choices are given, and it's a pretty connected process. So through those limits and through those choices that we offer, we facilitate the child's decision-making, self-control, and ability to assume responsibility. Every relationship is going to have limits. Every experience has limits. That's just a natural fact of life. But through acknowledging the child's feeling by saying, I know you really want to squirt that squirt gun, but setting the limit by saying, but squirt guns aren't for being inside. Then providing the child choices by saying, you can choose to use the dart gun, or you can choose to use the sandbox. We facilitate children's ability to decide for themselves, and also to control themselves and make choices that are appropriate for the situation, as well as assume responsibility for themselves. This also anchors sessions to reality. So some things are just not possible. We want to grant in fantasy as much as we can that which cannot be granted in reality. Some things aren't possible, and that is a reality in life as well. And so it's okay to anchor the session to reality. And it also protects the child, the therapist, and the materials. Again, this is about respect. We respect ourselves, we respect the child, and we respect the materials in the room. And again, this is it's a pretty delineated limit setting and choice giving model. I gave an example of how to use it But if you were to get more training in CCPT, child-centered play therapy, you would get much more intensive information regarding limit setting and choice giving. So we talked a little bit about child-centered responses and limit setting, like tracking and reflecting feelings, and reflecting meaning and reflecting content. And then also we talked about limit setting and choice giving. And so overall, incorporating those into the being with attitudes and the dynamic relationship between the child and the therapist, and the unconditional positive regard that the child experiences from the therapist. There's some characteristics of therapeutic responses. They should be brief and interactive. They should be brief because listening to a whole paragraph about what you're doing takes you out of the moment. Whereas if I keep my sentence very short, like, oh, you're really interested in that, that really keeps the child in the moment, lets the child know that the therapist is listening, and is interactive, and that it is the therapist interacting with the child, but also doesn't overwhelm the child. They allow the child to lead. The therapist is always wanting to understand the child's experience and trust the child's motivation for growth. And so in that way, we allow the child to lead. We don't direct the child to what to do. Excuse me. They're personalized. You're talking to another person in the room, and as adults, it's weird to have someone talk in third-person language. And so what we want to do is we always want to say you. We always want to keep our responses focused towards the person in front of us rather than objectifying the person in front of us. They touch feeling. They're very empathic, and they recognize and acknowledge the feelings that the children are experiencing. They're brief and interactive, and so they help the child to go on. They don't interrupt the flow. Like I said, if you have a whole paragraph of narration, then it's not going to be as impactful, and it's going to take the child out of the play. They're non-evaluative. Again, like we talked about a little bit earlier with praise and encouragement, we don't want to praise the child. We want to let the child know that we value them for who they are, no matter what their behaviors are. And so by avoiding praise and by being non-evaluative, we can maintain that sense of unconditional positive regard. And finally, they build self-esteem through acknowledging the efforts and the interests and feelings and experiences of the child. One of the things that we want to consider in play therapy is the identity and the background of the child. And so one of the ways that we do that is by having culturally responsive toys. We don't want to send the message that one way of being is the correct way of being, and we want all children to feel prized and valued in the playroom. And so having multicultural toys allows children to have a sense of familiarity with the playroom. If there's things that children recognize from home or from school, they feel more, they are allowed a stronger sense of belonging in the playroom. They feel appreciated, and they feel a sense of pride and empowerment that something is familiar to them, something that is part of their own identity is represented and is accessible and is important to be represented in the playroom. And so to this extent, it's important as a therapist to be very familiar with your culture of the cultures of your clients when you're choosing your toys, when you're selecting your toys, so that you represent the children who are going to be in your playroom. Working with culturally diverse parents in play therapy, children in play therapy are going to have parents or caregivers, and play therapists will always be working not only with the child, but really with the parents too. But one of the things, especially in multicultural awareness, is really understanding what parents from diverse cultures might experience when they bring a child to counseling. Since in many cultures, counseling is not the norm. There might be a stigma associated with mental health counseling. There also might be a mistrust of the system generally. And so knowing that your clients and your parents might be experiencing these things is a very important aspect of bringing children into the playroom and making it a safe experience for both children and parents. Understanding what play looks like and means within the client's culture. Play, like we talked about at the very beginning of this presentation, looks different, can look different for children from different cultures. And so understanding what play looks like within the specific context of the client's culture is important. Also, understanding family support systems. From people from collectivistic cultures experience support systems differently than people from individualistic cultures. And also the appropriateness and the intimacy with which family members experience connection and participate in the care for each other is going to vary from people for people from different backgrounds. And so a culturally competent therapist is going to be exploring and seeking to understand those things about their clients. And so one of the things that therapists can do is ask about previous counseling experiences, be very clear in explaining what play therapy is and what to expect and what the process is going to look like. Also, being very open with parents about what the playroom looks like and showing the parents the playroom. Parents are often understandably very concerned about the environments that their children are going to be in. And so showing parents the playroom and kind of demystifying the experience can really help parents feel more comfortable. And in addition, educating the community and really helping to fight some of the stigma or the mistrust of systems that might exist. Some of that to help advocate for better client care and mental health services. So one of the things that's important to recognize is the effectiveness of play therapy. There's a lot of research about child-centered play therapy and how effective it is in addressing different issues. And so this list is not exhaustive, but is just representative of the most recent research that has come out about the effectiveness of play therapy with various presenting issues. And so it decreases a lot of different presenting issues, including externalizing issues. So it has been shown to decrease kind of acting out behaviors like yelling, rule breaking, aggressive behavior, as you see there. It's also shown to decrease anxiety and worry in children. And this has been shown to last. It's not just while the child's in therapy, but it also lasts beyond therapy in terms of decreased anxiety and worry, decreased global behavior problems. As we talked about, play therapy helps children to develop self-control. And so overall, we see externalizing and global behavior problems decrease. Decreased child caregiver relationship stress. Parents can experience a lot of stress in parenting. And with that increase in self-control and increase in self-acceptance, oftentimes caregivers experience less relational stress between themselves and their children. Decreased social withdrawal. So that's like increase in social engagement in a positive way. Decreased irritability, decreased attention problems. Children, when you feel accepted as an adult, you often feel less irritable, less grumpy. Children are the same way. When they feel like it's okay to be me, then they often can feel less irritable, which also connects to the decreased caregiver-child relationship stress, decreased attention problems. There's been several studies that show that child-centered play therapy helps um, address children's ability to have self-control. And so sometimes we see that attention problems can be decreased through that. And decreased PTSD symptomology. This is really, there was a study done by about refugees and the PTSD experiences that they had, and children who experienced child-centered play therapy experienced decreased PTSD symptoms. It's also a very effective intervention for increased supportive outcomes for children, and so increased early achievement scores and increased academic performance. Again, we see continued effects with that as well, and an increased sense of self-efficacy. So children believe in themselves, and they believe that they're capable of doing things in the world. And again, this list is not exhaustive. It just represents some of the most recent research that we're seeing come out about child-centered play therapy. And on the next slide, I'll show you more information that you can go explore child-centered play therapy and other play therapy modalities. So if you're interested in learning more about research and the effectiveness of child-centered play therapy, you can go, one of the best sites is evidencebasedchildtherapy.com. They have a really good database that lists information not only about child-centered play therapy, but other play therapy modalities and the evidence and research studies to support them. It's usable and it's accessible, and it makes the research process much easier, I think. If you're interested in becoming trained in child-centered play therapy or in play therapy in general, the Association for Play Therapy is for therapists and parents and people seeking to be therapists. And so they list places where you can receive play therapy training. And then the Center for Play Therapy is focused strongly on child-centered play therapy, and they offer great training for learning more and working more with child-centered play therapy. And so the websites for Association for Play Therapy is a4pt.org, and the Center for Play Therapy is cpt.unt.edu. Thank you, and I hope that this was a helpful experience to help you learn more about CCPT.